Hello, and welcome to today's RateFast Speed Seminar. I'm Dr. John Alchemy. Today we're going to be talking about 3 critical questions to ask a qualified medical examiner regarding orthopedic injuries. We get this question a lot from multiple stakeholders here at RateFast, so we decided to talk a little bit about what are some of the basic things that any stakeholder can pick up a report and decide if a QME report is adequate with regards to the data collection for orthopedic injuries. Now let's go on to define. Recall that when a medical condition reaches maximal medical improvement, or also known as MMI, the QME is required to produce an impairment rating exam. In California, that impairment rating exam is to be done to the standards of the AMA Guides 5th edition. What we're going to be discussing here are orthopedic injuries that affect the spine, all regions, upper or lower extremities. Next, take a quick look at the report or ask the qualified medical examiner, number 1, are actual measurements actually being taken? Estimates and visual estimates do not count. It's the actual goniometer measurement and the actual measurements that are necessary to do the correct computations and properly exercise the data in the tables and charts. Number 2, are the measurements being taken at least twice for the upper extremity and at least 3 times for the spine or lower extremity in each plane of motion? Finally, in unilateral upper extremity injuries, is the uninjured side also being measured? Let's review that again. Number 1, are actual measurements being taken? This will require the use of a goniometer or an inclinometer, depending if you're measuring an upper or lower extremity or a spine. Number 2, are the measurements being taken twice for the upper extremity and at least 3 times for the spine or lower extremity in each plane of motion? And finally, in unilateral upper extremity injuries, is the uninjured side also being measured? Because remember, the uninjured side serves as baseline for impairment subtraction in Chapter 16. Finally, let's do some problem solving, and this is actually based on a real qualified medical examination performed in California. An injured worker comes to see a QME with a right shoulder injury. The QME reports the right shoulder range of motion as quote-unquote normal and no mention of the left shoulder at all. The question is, did she miss anything? The answer is yes. She actually missed all 3 critical actions. Number 1, she did not document any actual measurements. Number 2, she did not show that 2 measurements were obtained for each plane of motion. And number 3, she did not document the left shoulder similarly to use as the basis for an impairment baseline. This completes today's RateFast Speed Seminar on 3 critical questions to ask a qualified medical examiner for orthopedic injuries. Please visit us at rate-fast.com and click on the blog site to learn more about fast, accurate impairment rating. Thank you.